Welcome and thank you for reviewing HCI Active's COVID-19 Return to School Support Solution. This presentation includes a brief overview, followed by a demonstration of the key functionality provided via our member portals for staff and parents, and our client portals for your administrative leadership. After this introductory presentation, we encourage you to connect with your solution advisor to begin tailoring this solution for your organization. HCI Active is a leading platform for digital insurance policy administration, recognized by CIO Review as one of the most promising insurtech solution providers on the market today. We enable organizations to achieve greater consumer intimacy and loyalty with consumer-centric plan design and experiences. We streamline administrative processes by utilizing intelligent ecosystem automation across your entire organization. And we're able to scale rapidly and provide the operational agility your organization needs to adapt quickly and stay ahead of this disruptive disease. This solution has 12 major phases, starting with onboarding a census to the system. We then opt in each participant via the system and track participants in the system with a symptom screener. If a symptom surfaces, quarantine is recommended. Then we contact trace with the system to identify close contacts, if any, and recommend they quarantine. The system calculates their time in quarantine behind the scenes and can also collect return to school releases from medical providers. So clients can use the system to approve people to return to school. From the moment of launch, the system is unifying training of participants to stem the spread of COVID-19. And on-site testing can begin within 2 weeks of contract signing. All tracked and incentivized to achieve success over this disease, with built-in engagement to drive member participation and seamlessly connect to other HCI Active features. Launch quickly with engaging materials and an easy-to-implement solution. Deploy mobile and web interfaces connected to a single administrative system. Leverage an easy-to-use report dashboard providing real-time business intelligence. Take total command of shared spaces by offering a complete solution. Synchronize efforts with public health guidelines to keep COVID-19 out of shared spaces. Tailor tracking, tracing, testing, and more to meet your organization's needs. Our base module has 2 parts. A tracking tool we call the Symptom Screener, developed based upon CDC guidelines to have participants self-attest to their symptom status before each day, and a training component with the provisions of relevant educational resources, all packaged, incentivized, and ready to deploy. The suite also has a virtually unlimited array of the latest and best optional testing add-ons to detect current or past COVID-19 cases. Okay, we're going to move into demonstration of the portal. This is the member or participant portal. What you see here on the left is actually set up for a parent. There are buttons here on the left which can be customized for different participants. In this case of the parent, there are some of the basics of like linking to the educational modules and testing, and any special forms, documents, and links given organization may have. If this was the staff version, this may be extended. This may be part of their larger employee benefit program and would as well have links to their enrollment and election of benefits. However, for this, we're going to focus right in on the symptom tracker. And to help us along, we have this document. This document you will see as part of proposals to your organization and attached to an agreement. These are the major functionality of the primary workflow managing each participant as they track and manage their well-being. It starts with obtaining parental consent. Provided they agree to participate, they will then move to phase 2 of symptom screening. They'll continue to do this daily on behalf of each of their students. If at any point they should indicate a symptom for a student, they'll then move into a quarantine section of this, starting with contact tracing, identifying any close contacts so those can be forwarded to an administrator for outreach to those individuals so they can potentially quarantine, then moving the parent to direct the student to a medical provider, as well preparing them with a medical release form. If somebody is symptomatic, Quarantine for a certain period of time is recommended, but a doctor may release them early. So they could take this form to their provider, or the doctor may provide their own documentation or note. Either way, once they've been referred to the provider, they move into an upload documentation phase, where that gives them the opportunity to upload that note and information. And then that is, they're put into a waiting phase, and that's sent to an administrator to approve. Once approved, they then move into this back to school phase. So with that, I'm going to shrink this down. Okay, so what you see here is the parent's view. This particular parent has 2 students. This information comes via census provided, and then we link to that parent. Understand that students may be at more than one school. Students may be at elementary, middle, or high school. So moving over our document, we're going to collect consent. The first screen that a parent will see is a program overview. They'll click Next. Here they'll have the opportunity to look at program disclosures. There is a link to a document that they can download. They click to open the document. This provides key personalized information, the parent's name, the student's name, and then helps them provide some basic information about screening for symptoms, specifically describes what they're agreeing to, and then shares with them how they may withdraw their consent. That is a document that they can save. It'll be saved in their documents. Then they'll click Next. Here they'll digitally sign and decide on program participation. Typically they'll say yes, this is pre-populated with their name and their date, and they click Next. And then they're ready to begin symptom screening. Now before I jump into symptom screening, let's look at the alternative of if they say no. So on student 2, you'll see that similar, looking at the program information, reviewing the disclosure, and in this case they elect no. They'll be presented with this notice informing them that they are in fact not required to participate. However, access to school facilities may be limited. This is where each organization can set its own policy for what to do. When someone opts out, a notification is sent to a designated administrator, and they can decide how to follow up with this parent to either convince them to participate or to arrange an accommodation. Okay, so let's go back to symptom screening. Since we've opted in, we are now ready to do symptom screening. You'll note that anywhere that a parent leaves off, they can return right back to their next step. Here you're seeing a list of the options that are available. These are configurable. Your organization can include one or more of all of these. If a person elects no, which is more typical, come in here to do this screening. Once this has been submitted, they're complete and ready to go about their day. Symptom screening is typically projected to be done daily before each school day, but the interval can be customized and configured for any organization. Now let's look at the alternative. Okay, so let's look at student 2 here, who's going to do some symptom screening. Let's say now there is somebody in the home who has COVID-19, and this student has a fever of over 100.4 degrees. They are going to be reporting things that the organization has selected as screening topics. When they submit this, they'll get the confirmation that their screening has been completed. However, before they can progress, quarantine is recommended. Now, the CDC is directing organizations to have symptomatic people self-quarantine until they are either cleared by a medical provider or a certain amount of time has passed. So the first thing is to immediately self-quarantine. And when the symptom is reported, a designated administrator is notified by the symptom. However, we encourage participants that even though the school has been notified, They, in the case of the student, should notify school attendants, or in the case of a staff, their immediate supervisor, so that they know the student or staff has been directed to self-quarantine and that proper accommodations are made because they will not be attending. And then the next two bullets talk about the next screens that are coming up that involve contact tracing and following of the medical provider. So you can see, following along in our report, we're going to enter phase 3, contact tracing. Now, while much is not known about COVID-19, we do know it is highly contagious. And the CDC and other public health officials are suggesting that anybody who has been in close contact, which is described here in this document, which would be within 6 feet for more than 15 minutes of a person 2 days prior to a positive test or onset of symptoms, if this has occurred, they should self-quarantine. With this form, we want to encourage anybody who is suspected of having COVID-19 of identifying who they've been close with. In order to make sure that they provide full disclosure, we do want to encourage that their identity will be protected. We want to make it very clear to the person responding, as well as people handling this information, that is of the utmost importance that it is kept confidential, so there's no stigma or potential retaliation or any things that you do not want to have happen in collecting this information. The parent, in this case, would be reporting that perhaps the student was on Dr. Jones's field trip, and they stayed inside and had lunch with Cindy Brady, and then after school had music practice with Mick Jones. And so they would freeform enter this information here. We do want them to attest to this information being accurate. We don't want anyone to misrepresent someone who's a close contact, someone that they don't want to have at school. By providing false information. They would put their name in here, and then the date of this report, and then click Next to submit that. This report is then forwarded to an administrator for review and evaluation of whether those contacts should be notified for quarantine. Meanwhile, this screen is showing the participant thanking them for that submission, and then encouraging them to focus on the health of their family, and in this case the student, and encourage them to follow up with a medical provider. So we are in phase 4. Email notifications again happening to the administrator and parent in this case, and then when they click Next, it's preparing them for that medical provider visit. The system is explaining to the parent that to follow up with a medical provider, they will want to consider taking this medical provider release form with them. They can click and download this. This is a document that is pre-formatted that will collect basic information that a medical provider can sign off on and provide to the participant to help them get cleared to return earlier than, say, they might if they were weighed out in normal quarantine. So they'll return back to the screen and then can move, if they do have this document, can move to the next phase, upload documentation. Now, if a participant is on a desktop device, they'll use this screen to upload an image from their computer. If they're on a mobile device, then they would be using their phone, if it has an integrated camera, to capture an image of that particular document. They'll click Next to continue, with all this attached, and then they will be moved to this phase 6, waiting to return to school. The information that they've submitted will be forwarded to an administrator, and they will check back later when they can return to school. Whenever the administrator clears the document, then they'll move into this back to school phase, at which point they'll receive an email and then can return back to symptom tracking on a daily basis. Okay, let's focus in on the administrative portal. This is for clients or designated administrators. Will have access to manage the program, the enrollment, participants, and such. For this, just at a high level, I want to jump right into the reporting. With this, the Program administrators can access very powerful business intelligence and analytics. This real-time integrated program dashboard provides full visibility of each student and staff, your different programs, across all phases of the Return to School program. You can identify, the students that have opted in or opted out. You can, be looking at who's performed the symptom screening, their quarantine. You can also, essentially look at a particular school, and this is updated dynamically. This is some hypothetical data for a school district and their schools. And with this, you can drill down to really have total insight, and it gives administrators that ability to, just like I said, access very powerful analytics and enable the school administrators to really have full command and control over COVID-19 risk throughout the school district. Again, this portal has many features and can govern all of HCI Active's capabilities. But for this, just wanted to give you kind of a high-level overview of really some of the core elements of this program.